a verb, did not know that, and that this was something that warranted this urgent of a discussion. But just kind of catching up on the stats that have changed even in the last few months or last year, it is absolutely something that we believe so strongly in, and we're so honored and glad that this is being talked about and honored to be a part of it. Just wanted to kind of give a couple of stats here. The district kind of pointing to the Centers for Disease Control and Prevention. The use of vaping devices by high school students jumped 78% since last year. According to the Surgeon General, more than 1/5 of high schoolers say that they use them. Some studies show it's well over a third, closer to 40%. It also rose 48% among middle schoolers nationally. So you think of the average 11-year-old that you've seen walking down the street, and that just blows your mind. So we want to get some feedback from our audience here and see if you, quite frankly, felt as old as I did when you heard that information. So before this school year, how many of you had heard of Juuling? Show of hands. Okay. And of those with their hands up, how many of you heard of it from a kid in your life? Got it. Okay, gotcha. How many of you, kind of a second question here, know a teenager who actually does or has Juuled before? Okay, great. I really appreciate the honesty. So did you know that at some point, according to a recent survey, 24% of BSD juniors have tried a vaping product at some point? So once again, it's kind of well within that national range. What we've discovered is that there is a lot, shocking in this day and age of fake news, of misinformation about teenage vaping. Our goal tonight is to provide you with local experts, people in the know in a number of different realms tied to this topic, who can give you actual, tangible information backed up by their own research and backed up by experts nationally. So as you entered also, you were provided with the opportunity to fill out one of these lovely blue question cards. We have the cards, and we're going to be kind of bringing them up to the podium throughout. So if you want to go back out and do that, that's totally fine. If any questions, something comes to mind during this panel and you think, oh, tied to what someone said, I'd like to know more about that, wouldn't bother us at all. And we'll also be taking questions from our live stream. We're live streaming this at kgw.com, on our Facebook page, on all of our social media platforms. I believe the district has shared it onto their page, and then it'll be living on YouTube independently. So there's ever a time, and we got this question a little bit ago, if you want to go back and you want to look at something that was said, you wanted to show it to someone who missed it, YouTube would probably be the easiest way for you to do that. Facebook, obviously, you can share that as well, but YouTube is just easy to find forever, especially as we get months or years down the line. So once again, those watching this live stream, hello to you through our cameraman in the back, can ask questions on our Facebook feed. We have district staff monitoring that as well. Okay, so I want to introduce you to the lovely people who should be talking more than I am, sitting to my left over here. We're going to start with the three students with Providence's Rebels for a Cause group, and I think it's so amazing that you guys have stepped up to do this. They also made themselves available for TV interviews earlier today and did so on my deadline, which not even a lot of adults can manage to do. So we have Meghana Narahari, we have Ratna Bhupalam, and Anda Gergay. So guys, all here once again from Rebels for a Cause, really impressive high school seniors here in the area. We also have Southridge High School Principal David Nislanek, who also made himself available for me on deadline earlier today. We appreciate it. Beaverton School District Nurse Danielle Gonzalez, Gwen Ashcombe from Washington County Public Health. We have Dr. Bill Bauerfeind from Providence Health Services and also from the Oregon Clinic here today, and then we have Sergeant Kevin McDonald from the Beaverton Police Department. So we're going to ask some questions that we think, again, are the most poignant that we want to get out there ahead of time. We're going to ask them to specific panelists, but by all means, anyone feel free to jump in if you think something comes to mind. We want to hear from you three closest to me as much as possible, so just grab the mic from the principal to your left. You will not get detention. So we're going to start with just how bad the problem is nationally, and then if we can just bring it back to our local area as well here in Beaverton School District. So Gwen, if you could kind of start with the national part and just the information that you have on your end, we'd really appreciate it.
Yes. So what we are seeing nationally is exactly what you said, the 78% increase. Right now, from 2017, it was about 11.7% of youth using these products, but that jumped to 20.8% in 2018. So e-cig use is higher than all other tobacco products combined. So I say e-cigarettes because that's going to include Juuling. Any other vaping product kind of falls under the term inhalant delivery systems. So those are being the most used. It's the highest that we've seen of a tobacco product being used in the last 15 years. So I just want to highlight that Juul is a product. It's of a vaping device, but it does have nicotine. There are no zero nicotine cartridges available through Juul. So Juul's cartridges all do have nicotine in them. What we're seeing too nationally is that 9.5% of youth have used exclusively Juul as their starter product.
Okay, great. And then David, if you could kind of address the same question, and then we'd love one of our students, whoever would love to step in first, just to talk about your perspectives and what you see in schools here.
Of course, and thank you all for attending and thank you all for watching. I would say that the information from the local high schools mirrors the national average. We're roughly 20% of students who are using Juuls. I also would say that 10 to 15% of more students have experimented or tried with vaping or Juuling, and that number actually could be a little bit higher because I'm just guesstimating. I think the last point I would make with this question is in my 25 years of education, Juuling is the most rapid increase of a behavior that I've seen of all behaviors of teen usage of any sort of substance.
Okay, and then and more than one if you guys want to, of our students, please.
Yeah, so speaking from my own perspective as a student, at the beginning of my junior year, which was last year, I never knew what a Juul was. And since then, I've seen so many of my peers and so many people around me that I never thought would get into anything like drugs or Juuling, start to use this product. And I would say, like our principal said over here, that our national average is probably even higher within our own schools. I've seen students use it in the classroom, in buses, in the parking lots, and at school activities. So it's really, really prevalent in the school environment.
Yeah, and can I actually ask another of our students to talk about, like they said they use it in the classrooms. How in the world can a kid get away with that in the classroom? Because a parent might not know that.
Yeah, so I think from what we've heard, a lot of students are able to do it if their teacher's turning away, if their teacher's not paying attention in the class at that moment and they're doing something else at their desk. For instance, what we've heard is students will sometimes blow the vapor down their shirt or in their sleeve, or they'll kind of turn around and do it, so it makes it really hard for teachers to keep an eye on that, especially if maybe they like wave the vapor away and it goes away faster like that.
Okay, definitely. And then another one of our students as well, if we want to ask our next question here, do you have any idea how kids in your school are getting access to this product? And then you and I talked earlier today about the social media presence and like what makes it so appealing to these kids. So just from your perspective, what you've heard about how kids are getting Juul and vaping products.
Yeah, so what we've heard right now is just that if you look at it more of like a chain, it might be easier to understand. So you have this individual who wants this product for one reason or for another, and they might have other peers, other friends, family members who have access to this product and can provide it for them. So what might happen is they might purchase this product in bulk, and then what will happen from there is they can sell it for a profit to other students as young as middle schoolers so that they can have access to it. And we think what makes it really, really appealing is the fact that it's very sleek packaging, it's very inconspicuous. It doesn't have that traditional tobacco scent or that tobacco flavor. It has fruits, fruit, candy smells that make it really appealing to youth. And in addition to this, you have people from Instagram, people on Twitter posting about this, kind of promoting these are idols and celebrities that a lot of the youth might look up to. And so when you see them kind of promoting this product, it almost validates your actions in using it as well.
Okay, great. And then we wanted to get an expert's sort of perspective on this as well. Gwen, I wanted to bring it back to you. Could you talk about how addictive these products are? Because you mentioned that they have nicotine, but some of these have an extreme amount.
Yes, so Juul has the highest amount of nicotine concentrate than any other vaping device on the market. So with Juul specifically, it's a 5.4%, and that's equivalent to a pack of cigarettes, 20 cigarettes in a cartridge, so a pack a day, basically. Every other vaping device, the nicotine concentrate can vary. So if you're looking at drip devices, so you're using liquid juice in them, that could change from a 2.4 to a 1.7 up to a 3.5. There's no regulation on any of this, so they all can choose what they want to put in there. But we know Juul does definitely have the highest concentrate of what we're seeing on the market, and they don't make a zero nicotine cartridge. I think that that's been the most misleading information out, is while you can potentially get zero nicotine in other vaping devices or other liquid products, Juul itself is always going to be nicotine, and it's always going to be at that high concentrate of 5.4%.
Sure. And then can I ask you or Dr. Bauerfein, because I'd love to hear from you too, your thoughts on, I mean, first, kids are told, or we've heard kids say that this is harmless. It's water vapor. It smells like fruit. And if you could just give your reaction to that common impression.
Yeah, sure. So I think we get wrapped up in this idea of Juul and e-cigarettes being safer than regular cigarettes. And one thing, if you don't learn anything else here, I would say safer does not equal safe. We're comparing it to a cigarette, which is the only product we allow to be sold that, when used as intended, kills the person who's using it. So think about that. That's what we're comparing the safety to. So the other thing about these, the nicotine in Juuls is actually engineered a little bit differently than regular nicotine. So it's a nicotine salt that is actually a little bit more addictive and easier to consume, less irritating. And that's another thing about these products, is compared to cigarettes, they're less irritating to inhale. They're also not in discrete quantities. A cigarette is a certain size, a certain dose, if you will. A Juul, you can puff on that and you don't know how much you've consumed. The chemicals in these things we don't know enough about. What we do know about some of the chemicals, there are some of them, propylene glycol, for example, and there's glycerol in them. These things can be respiratory irritants. We know from certain studies that they do cause transient decreases in lung function. One of the problems is we don't know the long-term consequences of this, and this we've seen in so many other industries and products. Asbestos and even cigarettes way back when were thought to be healthy. We don't know, we don't have enough data, there isn't enough long-term use of these things to know what their long-term consequences are. And you don't want your kids or you to be the person who 10, 15 years from now, the reports come out that these things are a hell of a lot more dangerous than we think.
And can I ask Ratna, because I wanted to hear from you. I don't think I've talked to you yet. You mentioned, because you used the phrase, the guinea pig generation when I talked to you earlier. Can you tell me what that means?
Yeah. So in the past, when cigarettes were newly introduced, doctors and other medical professionals used to endorse them, and they used to think it was healthy. And the same thing is happening now. But it's not doctors and medical professionals who are endorsing them, rather it's celebrities and people who the youth look up to. And not only celebrities, but huge fashion brands such as Supreme or Louis Vuitton are even creating packages for the actual Juul. So that's like one of the biggest things that we've been noticing here, is the way that Juul has been strategically marketing towards youth. And we are the first generation to catch a hold of this epidemic. So that's why we consider it to be like we're the guinea pig generation.
Yeah, it's like a disturbing phrase when you think about it. Danielle Gonzalez, I know we haven't talked to you yet, again, district nurse with Beaverton Public Schools. Are you seeing kids who, based on your impression from them, are addicted?
Well, unfortunately, I don't have any high schools or middle schools that I am in, but I have heard that this is a problem, and you're reading information from the internet and studies that are starting to come out. Kids are definitely becoming more addicted to the Juuling products.
And then David, just same question to you. You and I talked about this earlier as well.
Yeah, we did talk about this earlier. I do see kids becoming addicted to Juuling, and what's disturbing is that the students who are using Juuls don't see it as addictive. I love the phrase, the guinea pig generation, because a lot of students who we are interacting with don't see it as a problem. And Juuling is happening across the whole day. It's happening before school, during school, in the restrooms, after school, at activities, on the school buses, and friends' home. We have parents who are purchasing Juuls for students. And as students are using Juuls, we're seeing this addictive behavior becoming more prevalent, and it's really hard to combat.
Yeah. And can the two of you talk about sort of what the district is doing or trying to do? Because you mentioned earlier today, harkening back to our convo, but you said, you want to walk that line between accusing a child, you don't want to do that and sort of make them distance themselves, but you want to call out what you're seeing.
Yeah, correct. Whenever we work with a student to support a student in addictive behaviors or in any sort of discipline action, we want to make sure that we're supporting a student. We also need to provide education. And since so many students don't understand the impact of juuling, when we're providing a consequence, we're also providing education. And so sometimes that two-way street is a roadblock, or sometimes that two-way street is a long street to get through. But when we're working with students to try to provide a consequence that is not only going to be punitive or reflective, but at the same time going to provide an opportunity to think about what's going to happen in the future. Because so many kids don't see themselves 10, 15, 20 years down the road when they have breathing problems or if they have health issues, because it's so here and now for many of our students.
Yeah, I want to pull in a question that we got from the audience. This is the first one that was turned in. Any of our health officials who are here, I'd love for you guys to weigh in on this. A parent wanted to know if there's any way to test or sort of definitively tell, basically, if your kid is using this stuff.
There is a blood test that can be done to detect the nicotine levels in people, but that's really the only definitive way is through the testing for the nicotine that you're going to know.
Okay. Go ahead.
There's other things you can be on the lookout for, though, is the vape kind of leaves a very faint but sweetish kind of smell in the air. So if you're noticing you're smelling cotton candy when there shouldn't be, things like that, that would be a clue to you that something's going on. Also noticing if there's any changes in behavior, excessive thirst, anything like that might be that wasn't there before, could be something that you're noticing. Any moodiness that's not attributed to normal adolescent behavior, but excessive moodiness, which kind of could say that they are waiting to take, they're already addicted and they're waiting to take the next hit, and so they're irritable, they're irritated, they're extra moody because their body is saying it's time to do that. That's what tells me is in the work that I do, what's so alarming is that students are having to use these products throughout the day in school. That tells me that the addiction is probably already there for them. They can't typically go 1 to 2 hours without having another hit, which is very similar to traditional tobacco. So it's something that it's concerning to me. But you can be looking for those kinds of things with your kid, and if you're noticing these subtle changes or these smells or finding things that look like a flash drive but a little bit bigger, any paraphernalia, those are things you could be looking out for.
And then Sergeant McDonald, I don't mean to ignore you. I really appreciate you being here. Can you tell me what you all are seeing on your end as far as kind of spotting this problem or wrapping your arms around this problem from a law enforcement perspective?
Yeah, as we're talking about this, I know we have focused a lot on the use of nicotine with the inhalant devices, but also marijuana is being inhaled. And there are manufacturers and kids are getting marijuana through these same devices. So that is something we are seeing in the schools. As a matter of fact, one of my SROs today had a student with multiple vials of the juice for marijuana. So that is something that we're seeing. But from the law enforcement perspective, we're really working with the schools as far as consequences. And a lot of times it ends up being more of a school issue than a legal law enforcement issue. Okay.
And someone, we did want to ask too, just legal consequences of this. I mean, sometimes if nothing else, that does impact someone's decision.
Right. So the Oregon legislature passed Senate Bill 754, which covers possession of these devices. The governor signed it in August of 2017, and the law went into effect January 1st of 2018. And so what it says, it does give some guidance on retailers selling these devices. It also talks about possession of the devices. And if you're under 18, it's a D violation, but the legislature did not create any penalties or consequences if you're 20, 19, or 18. So it's very much under 18 consequence, if you will.
Okay. I want to bring it back to our students really quick because there was something else that one of you mentioned to me earlier about kids like giving up activities to kind of like make time to make sure they can vape when they need to. I'm also wondering though about cost. Do you guys have any idea how much money kids in your school are spending or where they're getting this?
So we're not sure how much each student spends. It does depend on how frequently they go through a pod, which has the juice and the nicotine that they put in a Juul. Some students, if they're more addicted, can go through several at a time. Some go less, and they kind of do it more like a social event. So it does depend, but kind of like what Gwen touched upon, like one way you can sort of see if maybe your student or someone is using a Juul is if they're using a lot of money in a short period of time. It might be them purchasing either for other people or for themselves and refilling those pods. But we aren't sure exactly how much each student. We can't put like a quantifying number.
Okay. And then as far as like spreading the information that you guys are hearing today, which is the actual information and trying to like combat what people are seeing on social media, how much would you say that kids are getting, the information that they get on this is from social media? How much of it?
I do think a lot of students are kind of getting misconceptions from social media.
Yeah.
I don't think they're getting a lot of that true material that we're trying to get to them. We have done, posters at our school. We've done presentations. We've done community outreach events. So we do think that we're trying to spread more of that truth and clear up those misconceptions so students and parents and staff can be more educated on it and not just kind of take what they see off of social media as granted.
Okay. This might be a question for some educators here or health officials. What should we do when we find out about our kids using this? Any advice based on your experience, perhaps? And then just parent to parent, we may not know the other kids that they're hanging out with, and any advice on sort of maybe talking to the school, relating to their friends. David, yeah, that'd be great.
Great question, and I think that the answer to that depends upon family dynamics and family conversation. But if I were a parent of a student who's Juuling, I would reach out to the school guidance counselor. I'd reach out to the school for support. There may be other resources that may be a better fit for the family. I think a pediatrician and medical support would be an important step as well. I think also when you look at students and are they possibly looking at their attendance patterns, looking at their behavior patterns, looking at the lack of work that is being turned in, or if there's a shift of behavior with school. If they were heavily involved in activities that are not as involved in activities, I would be asking some questions around some addictive behaviors. But I think reaching out and asking a person in the building who you trust, and oftentimes that is a guidance counselor, who will be able to provide resources in the community that will be able to help.
Yeah. And then I know we talked about, excuse me, did you want to, please?
I was just going to say there's a couple of resources that I can give to you today. If you call 1-800-QUIT now, that is a tobacco cessation program that will help. You can also go to a really awesome website that I found that's called smokefree.gov, and there is a specific smoke-free teen part of that website, and it gives you lots of different methods for stopping. It has text messages that they'll send to your teen on a daily basis. It maps out a whole plan for you. So it looked really nice. But I would just encourage that anybody who is stopping the use of nicotine have a program that they're working with their pediatrician or their primary care doctor, because it should include a physical aspect as well as a behavioral support. It's not a fun event to stop nicotine.
Could we we had another question. This is really interesting, and this may be you guys who might want to tackle this, or I think anybody on the panel may be uniquely qualified. Someone asked, what are some of the slang terms that kids use, or anyone uses, frankly, to use vaping products, especially if discussing marijuana? Have you guys heard any?
I would say most of the terms that are used in reference to Juul or Juuling are generally Juul or Juuling, but a lot of the times I've also heard students going into their cars, and it's called hotboxing, so essentially blowing smoke out of your Juul or whatever your vaping device is until your entire car, the space that you're in, is covered in smoke and you're inhaling the smoke at an even faster rate.
Okay. Any from the law enforcement spectrum? I know, Sergeant McDonald, you mentioned marijuana, and
I
we're
was
sounding so
searching my
clinical
mind for
talking
the
about it
slang
like this, but
terms.
yeah.
Nothing's coming to mind at this moment. I was actually looking at the students thinking that they may have a better knowledge base in that
Yeah,
area.
you might be the last person that a kid would
Right,
tell
yeah.
what slang term they're
But,
using.
you know, getting back to the marijuana issue, it is something that we are seeing almost at the same level as nicotine usage. So that is something that is out there, and it really, the vials of the vape or the juice can be difficult to discern which is which. So that adds to this whole issue and problem.
Okay. Someone just wrote, someone said that people feel like they can't go for 2 hours without juuling. Does this include during the night when they're sleeping? Any perspective on waking up to do this? Is the pull that strong?
So yes, the withdrawal from nicotine can begin about 30 minutes after the last use. Definitely people, and I take care of adults primarily, who are smoking cigarettes and also using electronic cigarettes, but yes, insomnia is part of the symptom of withdrawal as well, and so there can be frequent awakening, and then patients often are prone to using these devices in the middle of the night during those awakenings if they occur. But the withdrawal is significant and occurs pretty rapidly.
We also had something else to add.
Please.
Not like during the night, but during the day, just like from a student perspective, based on what we've seen in our own schools, it's really common for students to constantly leave the classroom and go to the bathroom. Recently, in one of our local schools in the district, a ton of students were vaping in the bathroom, and it set off the fire alarm, so the whole school had to evacuate. In another school, there was a big word Juul spray painted on the side, and in another school, there was a Juul that was caught in a yearbook photo that was undetected by administration. So it's just simple things like this that add up that can show how big this issue really is, just like on a general school day too.
I asked, I believe it was Rana, a question when we were doing our interviews, and you guys all kind of laughed. I said, like, your perspective, how in the dark are parents here? Like, we're quite literally having a seminar on something that is an everyday part of your life. And so just, I mean, your thoughts on, like, how much catching up we hope parents can do.
Well, I think as of now, since the device and like Juul itself is particularly new, students, staff, and like parents too are really like left in the dark about what it is and what the effects of it are. And I think that education is one of the biggest things that we can do right now.
Yeah. Any advice? Someone asked, you know, what should I do if I find out my kid is doing it? Like, any advice from your guys' perspective on approaching your kid?
I think it's important to make sure that the student has a support system, and rather than just like making them quit cold turkey, like talking to your student and like knowing why they started in the first place, if it was just to fit in with their peers or if there was another reason that they were coming to the Juul in the first place.
Sure. David, you and I asked you this question earlier, and any adult, please feel free to weigh in. You guys can weigh in too. But any adult, feel free. We were saying, you know, we kind of came of age during this time when everybody knew how bad smoking was. And everybody was spreading, there was like truth.org, and there were campaigns on MTV, and it's disgusting, it'll kill you, the science is in, we're done. And now we kind of have this bizarre sort of, it feels like a regression, and we're seeing this similar, like, awful deja vu. Just, I mean, your thoughts, and I said, how mad are you at the adults who are marketing this to kids?
Well, it's frustrating because we live in a void. And so students are hearing information about Juuls and the positive effect of Juuling, and there's nothing that is countering that conversation in the community or in the marketplace. And so from a school lens, when we're working with students, they don't see or hear the negative effects of Juuling unless we present it to them. There's really very little information out that is student or teen accessible. And so the more information we can provide, the better it's going to be, because this void that we're living in is not going to be felt for 10, 15 years. And I think the work that the Rebels are doing actually needs to be applauded and recognized, because we have kids in our own community, young adults in our own community, who are taking it upon themselves to educate their peers in all of our high schools to recognize the negative impacts of juuling. And so hopefully, as students begin sharing information about juuling with students, on the negative side of the conversation, it will help all of us, and especially the adults who are probably 2 years behind in the conversation compared to other students.
You think just 2 years?
Well, it's such a new phenomena that
yeah.
it's hard to say because we're moving so quickly in the
Right.
conversation.
Kind of same question. Anybody who wants to weigh in, please.
Yes. So to kind of bring it back to Juul itself, I just want to give just some background to Juul. Juul's hit the market in 2015, so it is a relatively new product. By 2018, it was worth $16 billion. So you can see how, and it was all through very great marketing tactics. Everything they did was buy the tobacco playbook to make sure that they were appealing to youth, to using bright colors, to using taglines saying get vaporized. They use young people in their ads. They also did made sure they had Instagram influencers to basically model their products. They had launch parties. They had big giant billboards in Times Square. So this was a very thought out, very deliberate campaign to target our youth. Altura, which is the largest tobacco company right now in the United States, recently purchased stock, about 35% into the company. That brought Juul just recently up to $38 billion. So this is an industry that is very well versed in how to reach our kids and are very skilled at doing so. So it's not a surprise to me that youth, heard these claims that this is something clean, this is something healthy, this is safe, and who doesn't want those things, right? You want to be clean, you want to be healthy, you want to be safe. Well, those were strategically placed to get youth to start experimenting with their products, and that's exactly why we've seen such this dramatic increase in our youth using them today.
And Dr. Bauerfein, I guess, same question to you. Like, is it just mind-blowing to you to see this resurgence of another kind of inhalant product?
Yeah, it's heartbreaking. We had been reaching the lowest points of cigarette consumption historically in the last several years before this phenomenon started the upswing again. And we were talking about dangers before. We know the dangers of cigarette smoke. The dangers of Juul, we'll be talking about that and the repercussions of that in the years to come when the data comes in on that. But what we do know, and I should say that anytime these papers are published now, they're out of date by the time people are reading them. But there was a Journal of the American Medical Association in Pediatrics from 2017 that showed that kids that used electronic nicotine devices were 3.5 times more likely to go on and become smokers. So we're at the very start of what I think is going to be an astronomical climb in cigarette smoking, hookah smoking, combustible tobacco smoke that's really going to rob us of the benefits of the last generation of improvement and health improvements that we had gained. We're about to lose all of that, and it frustrates the heck out of me.
Sure. And actually, we had a two-part question, and the second part, are you okay? Is perhaps really relevant to what you just said, and it's thoroughly depressing. Someone wanted to know, would it be worthwhile to start educating elementary school kids in this?
And indeed, that's in part what the rebels are helping to do.
Yeah.
They're helping to educate middle schoolers, and they're doing a phenomenal job, and we need more kids like the kids at that end of the table to spread this message.
Yeah. Any weighing in from perhaps some of our educators, though, or Sergeant McDonald, too? DARE is a program that was in elementary schools. Is this something that we need to
We're
implement?
not currently doing the DARE program here in Beaverton right now, but I was just trying to think if we've had any cases where there have been elementary-age kids in possession of a Juul. I think we've had one, but I'm not 100%. I haven't seen the usage. It is the middle schools, though, that right now I think that I'm seeing that, and then certainly the high schools. But it is in our middle schools for sure, and that is something that I've seen.
Sure. Is vaping or juuling education, though, part of the DARE program in elementary school?
I don't know with that curriculum if that's still included or not, because I haven't looked at that curriculum, and we're not teaching that right now in our school system. Nationally, it could be part of that. I don't know if it is or not.
Okay. Let me ask you guys on the end. I mean, you look at elementary school kids, and maybe you have younger siblings. Do you think, from your perspective, that's too soon to start talking to them about it, or do you think it's warranted?
I would say at an elementary school level, it might be too soon, especially since right now we haven't seen Juuls really progress into that age level. But one of our biggest mission as Rebels is to educate. So one of our goals this year was to educate middle school students around our district as well as high school students. And I know that personally in our own school curriculum, the education in our health classes about smoking and tobacco hasn't progressed to inhalant and vaping products like Juuls and vapes. So the education that we're doing on social media and the education we're doing as a club and at booths in our school and just the word of mouth and any education you can do as a person helps a lot.
By the way, before I forget, what are the hashtags that you guys use if people want to search those?
Yeah. So the one that we came up with, it's on the back of our shirt, is E6 make the vapor, don't be the sucker. So that's the one that we kind of promote and use throughout our program. Oh yeah, and then we also have it's more than just vapor.
Okay, great. Sergeant McDonald, so we had that two-part question. The first part, I think, would be related to you. Is there any action from police to track who is selling? Our students mentioned someone might be buying in bulk and selling.
I am aware of some cases we've had within our school system of those students doing that. Those cases are typically sent to our juvenile department here in Washington County for adjudication. But that is occurring, and a lot of times we will work with the school to resolve the issue and kind of track it. But we haven't had, at least to my knowledge, we haven't had a ton of cases where administrators found someone selling them. Mm-hmm. It's usually the possession of the Juul device or vape pen.
From your perspective, is their impression correct that maybe someone of age goes in and buys a bunch and sells it, or do you know of any cases where a kid's gone in and just hasn't been carded?
I think it's more prevalent to see the purchase through the internet because they can do it easier. And I would imagine most high school kids know how to use the internet to their advantage. Amazon, I don't know if you can buy it on Amazon, but websites where that's sold, or they have a sibling that they can have it delivered to if they're older. So the internet, to me, is a more likely way that students are purchasing these devices versus going to a local retailer.
Go for it.
I also just wanted to add on from a student perspective, in addition to buying it online, I've seen a lot of students who have older siblings who buy it in bulk, and then their siblings who are in high school essentially are able to sell it for a marked up price to other students and basically create a lot of profit, and they market their selling and the products that they're selling on their own social medias to help spread the word, and this is often the way a lot of the kids get their products.
Okay, we just had one more. I think this might be our last crowd question, and it was interesting for health experts here. Number one, how long does nicotine stay in your body? And number two, can you get it from secondhand smoke? And I'm wondering, we're talking about secondhand vapor here. Is that as much of a risk factor as we know secondhand cigarette smoke is?
So the effects of nicotine begin to wane at around 20 to 30 minutes after you've consumed it. What was the second part of that question?
Secondhand vapor or secondhand smoke.
Yeah, so definitely these vapors are exhaled and inhaled by others. So you're taking in the same thing, similar to secondhand smoke from cigarettes. The nicotine's in that vapor. The rest of the vapor, also other chemicals we've mentioned, but other things like formaldehyde and glycerols. There are certain components of the metals that are used, the heating elements. So there can be hard metals that are also being brought into the atmosphere and exhaled and inhaled by people who aren't the direct consumers of the Juul, but just in the presence of them, that can have dangerous long-term effects.
Sure. Okay. Well, I know we had another question about the laws surrounding it, and Sergeant McDonald, I know you touched on that. People are asking, do you see any more, from law enforcement perspective, any more options that can be used to just sort of counter this? I think was the heart of the question.
Well, I was just thinking about the internet purchases. I had talked about that a little bit. Oregon is one of only 5 states that have a tobacco possession law. If you're under 21, you can't possess tobacco. So in other states, it's typically 18, which is lower. So if you're buying these items on the internet, you just need to find someone that's 18. That makes it a lot easier for students to do that. As far as the enforcement part of it, really the penalty for if you're under 18 in possession of a Juul or vaping device is a violation, and we'll refer it to our juvenile department, but you know, personally I see this as more of a health issue, and really I don't know if it's something where down the road we look at this from a perspective of educating the students of why possession or using these devices is harmful to them.
Yeah.
There are also like other prevention strategies that have been proven effective in other areas of the state as well as nationally. We are one of 9 states that does not have tobacco retail licensure. So you need to have a license to sell alcohol, you need to have a license to sell marijuana, but you do not need to have a license to sell tobacco. So that is something that is proven to be effective in that you can, if you have a license, then you can hold retailers more accountable. Also things are being looked at such as raising prices through taxes or things like flavor bans. Right now there's over 7,700 flavors on the market and about 240 get introduced almost every month. So if you ban flavors, we know that is what's appealing to youth. They're using fruity taste, you know, all these other things. If you can ban the flavors, then the hope is that it wouldn't be as appealing for youth to use a traditional tobacco flavored vape product. So these are just some prevention strategies that we could be exploring.
All right, everybody. Well, I think we're kind of getting close to the wrap time here. If I could just ask, I know we wanted to summarize again, like what's being done on a local level. If Danielle or David want to touch on district-wise, and then Gwen, if you want to talk about other efforts within the county, just to kind of sum those points up.
I think from a district level, the communication plan that has been put in place by our district is supporting families in understanding juuling and vaping. I think as an administrative group, are learning collectively in supporting students, not only in how to not juul, but also understand the health impact is important. And I think collectively as a community, the district wants to partner with all stakeholders to ensure that we are supporting our students and our youth to lead healthy, productive lives, and then also really supporting the rebels so that our student leaders and our student voice can be heard in all high schools and all middle schools, because I think high school might be too late to begin the conversation, and middle school is where it needs to begin.
All right, Danielle or Gwen, anything to add?
So I think communication is key. So definitely making sure that we're educating both the student and the staff and the parents, but bringing it into the classroom I think is going to be the next step. It's making sure that students really are getting the correct information, and then having them work on prevention, asking the students like what would make a difference to them, how can they figure out a ways to fix this problem. I think it's hitting our youth, and the youth need to be the ones to kind of help lead the change.
So at the county level, I co-chair our Substance Use Prevention Collaborative. Danielle is part of that work, as well as our Rebels students have been involved as well. We are working to try to reduce substance use within our youth, so not just tobacco and vape, but we're also looking at alcohol, marijuana, and other substances. So we are bringing community stakeholders, other organizations that have a vested interest in youth prevention to come together and have these conversations. We're looking for new members all the time, so we're looking for parents, we're looking at anyone that has a passion for this work to join us in our efforts to reduce use among our youth.
Okay, great. And then I want to give the last word to our rebels, because you guys did a lot of hard work to get us here, and I think it's incredible. So we have Meghana, Ratna, and Anda. Anything you guys just kind of want to leave people with, or if you want to just kind of summarize like the point of today that you all wanted to drive home?
I think one of the biggest things right now is like noticing how big this problem has become, and like even in like our middle schools and high schools. And one of the things that we wanted to emphasize is that you are 4 times more likely to start smoking in the future if you use vaping devices such as Juuls or other electronic cigarettes now. So I think that's a really big thing to keep in mind.
Okay, great. Well, thank you guys so much. Again, this has been Vaping, Juuling, and Teens Get the Facts, and we really appreciate all of your questions from the audience. We really appreciate all of our panelists, especially the rebels. So thank you so much, everybody. Good job. That's it.